Hello, welcome to the sixth nonprofit data virtual seminar. I said this is the sixth seminar in our series, and this is the first one of our second season, if you like. We had a first set of trial seminars at the end of last year and into the start of this year, and now we have a few more seminars in the run-up to summer. So the aim of these seminars is to share research from lots of different places that focuses on or about the nonprofit sector, the third sector, broadly defined, particularly focusing on data and on methods and on sharing learning in working with those. As I said, this is the second season, so we have a program of seminars coming up over the next few months. You can find the link to the program in the description of the video if you want to see what else we've got coming up. We have a presentation today, and you can join in. So if you have questions for our speaker, then you can just ask them in the YouTube comments, and I will relay them and curate them at the end of the presentation, so that you can join in on the discussion. So please do comment or ask questions as we go along. Today, I'm delighted that we're joined by Astrid Pennerstorfer from WU in Vienna, the Vienna University for Economics and Business, where she's an assistant professor in the Institute for Social Policy. Astrid's going to talk to us about geocoding data about the third sector, and I'm really excited to hear what she has to say. So Astrid's here with us. Hi, Astrid. How are you doing?
Hi, good, thank you. Thank you for having me.
Excellent. Well, I will pass over to you, and once you're all up and running, I'll just confirm that we're all set, and then on you go.
Yeah, thank you for the introduction. As Alasdair said, I will talk about the use of geodata in nonprofit sector research today, and in the course of my talk, I will present a current research project of mine, which is concerned with spatial accessibility to Vienna's childcare system. And I will switch over to the slides right now. Can you see that, Alasdair?
Yep, that's perfect. We're all good.
All right. So when geodata are in use in nonprofit sector research, a central topic is often the distribution of services. And the underlying question then is whether nonprofit organizations can reduce spatial inequalities. Looking at relevant theories first, we could answer this question with both yes or no. There is a theory that states that nonprofit organizations mainly provide goods and services that are undersupplied by other institutions, and that nonprofit organizations are more responsive to local needs. So spatially, they should emerge in locations with a lower supply of services. But on the other hand, there are deliberations that due to a lack of local resources, nonprofits are not able to supply services equally across space, so they would not be able to reduce spatial inequalities. Empirically, there is quite a large body of empirical evidence. These papers mainly look at determinants of the location choice of nonprofit organizations, which is a mix usually of local needs, the availability of local resources, or the locations of other similar organizations. And of course, results are quite mixed, but in general, I would say that they point in the direction that poorer areas exhibit lower prevalence rates of nonprofits. In order to answer such a question, ideally we need data that are small-scale geodata. So now I would like to present an empirical application that is concerned with inequalities in spatial access to childcare. And for this example, we use geodata, first of all, containing the exact locations of all childcare institutions in Vienna. And then geodata containing information of the population of Vienna, most importantly, the age of the population. And we ask if we can observe socioeconomic disparities in local accessibility to daycare in Vienna, and if public and nonprofit providers behave differently in creating any disparities. Let me give you a short motivation for this research. We know that children from a more disadvantaged background benefit more from childcare participation than children from a higher socioeconomic status. But at the same time, children from a more disadvantaged background use childcare less often than children from a higher socioeconomic status. And the main reasons are differences in affordability and availability. And we look at the spatial dimension of availability because we think that this is a key factor in childcare. First of all, parents often state that the spatial proximity is an important choice factor. And also childcare markets have been described as geographically very small markets. In a previous project, we looked at market entry of childcare institutions, and we found that entry depends on the number of children in the vicinity, but the effect diminishes very quickly and becomes zero if the distance between the children and the facilities becomes greater than 500 meters. So the catchment area is 500 meters. To give you some context of the childcare system in Vienna, this is a mixed market, and almost exclusively we find nonprofit and public daycare providers. At least nowadays we have no for-profit daycare anymore. And over the last few years, the number of daycare institutions has increased quite impressively, and accordingly also usage rates have gone up. Also, there were some policy changes in the year 2009. First of all, daycare became cost-free to all parents, and attendance has become compulsory for children in the preschool year. Also, the role of nonprofit organizations in service provision was massively extended, which you can also see here on this slide. The number of public daycare institutions remained more or less stable over these 8 years, which you can see in the solid line. But the number of nonprofit institutions massively increased, which is reflected in the dashed line. We used a data set that, as I said, contains all daycare facilities in Vienna. We have annual data that we got from the city administration for the years 2007 to 2014. But really, to answer our research question, a simple list of all childcare facilities, including the name and the address, would have been enough. And such a list for Austria is available at the Open Government Data website, where you can download such a list, including the name of the childcare facility, the address, and the X and Y coordinates. So with the coordinates, you can project the locations of the childcare facilities on a map, and I show you an excerpt of Vienna on this slide. And the black dots on the slide are the locations of the childcare facilities. On the demand side, we use population data that we got from the Austrian Statistical Office. And these are very small scaled grid data at the 250 times 250 meter level. And on that level, we know the people living in such a grid cell. We know the age of the people living in the grid cell, and we have some other control variables, such as the educational attainment of the population or their employment status. And for our research, the age groups are most important so that we know how many children between the ages 0 and 6 live in a grid cell. On a bigger geographical level, we use the average income per district and estimated housing rents. We use the QGIS software, which is an open source software to link the point data of daycare centers to the grid cells, and then we aggregate it at the grid cell level. So here we have the previous map with the grid cells added. And in this example, you can see the number of children between the ages 0 and 6 living in each grid cell. The goal of our empirical strategy is to measure the accessibility to daycare for each child in Vienna, and to analyze whether children living in a neighborhood with a lower socioeconomic background have lower spatial accessibility. So first of all, we have to calculate an accessibility measure for each child. And we use a variant of the two-step floating catchment area method, which is a method that so far has mainly been used in health economics. And in order to measure socioeconomic differences between neighborhoods, we use 3 different indicators, which is first of all the share of residents that have a university degree, and we have that information on the grid cell level. Alternatively, we can use the average district income, but spatially this is a rather crude measure because Vienna has 23 districts and we have that information only on district level. As a third alternative, we can use estimated housing rents, and spatially this is in between the grid cell level and the district level. What we then do method-wise is rather simple. We look at the relation of the 2 variables descriptively and also estimate some OLS regressions. But first, I'd like to explain how the accessibility measure was constructed. And for this, I'll show you an example first in order to explain the idea of the measure. So in this example, we want to measure the accessibility for these 23 children living in this grid cell. And these children have 4 childcare institutions in their vicinity, in their catchment area. So obviously, accessibility is higher if there are more daycare centers in the catchment area. But accessibility also depends on the size of each daycare center and on the question how many other children live in the catchment area. And finally, on the distance between the children's place of living and the location of the childcare institutions, so that closer childcare facilities get a higher weight than facilities that are farther away. Mathematically, this is step 2 here on this slide, where K denotes the capacity of a daycare center. R is the degree of capacity utilization. And F is a distance decay function, adding weight for the distance between the children and the childcare facilities. In order to calculate R, the degree of capacity utilization of a daycare center, we change the perspective. The capacity utilization is calculated for each childcare institution. So in this example, we want to calculate the capacity utilization for the childcare institution depicted with the black dot in the center of the circle. And this depends on the children living in the catchment area. And again, children that live closer get a higher weight than children living farther away. Mathematically, this is step 1 here on this slide. Summing up, the accessibility is higher if there are more daycare centers in the child's neighborhood, if facilities are located closer to the child's place of residence, if centers are bigger, or if fewer children live within the facility's catchment area. Accessibility, the accessibility measure can be split by the type of providers so that we can disentangle how much each type of provider contributes to the spatial accessibility of each child. Coming to the results, I show you three figures first that depict the accessibility measures for varying neighborhood quality. As I said, we have three different indicators to measure socioeconomic differences between neighborhoods. On the upper left-hand side, we used education as our indicator. On the upper right-hand side, we used income. And at the bottom, we used housing prices. Coming to the example for education, we see that, or to explain, a good neighborhood is measured by a high share of highly educated people, which is depicted in a solid line. A medium share is a dashed line, and a low share of highly educated people is the dashed dotted line. So looking at the three graphs, we find that the good news is that accessibility improved over time for all socioeconomic groups, but we can clearly see that accessibility is much higher in better off neighborhoods, and this pattern does not change over time. The results of the OLS regressions support this. On this slide, you can see the results of 9 different OLS regressions. And in the first column, we find the results of the models that are estimated for this spatial accessibility measure that is based on all nursery groups, irrespective of their institutional form. And the second and the third columns disaggregate the results for public and nonprofit institutions. So we find higher accessibility in neighborhoods where residents have a higher socioeconomic status, and it does not matter which indicator we use to measure socioeconomic differences. And when we disaggregate the results, we see that they are clearly driven by the nonprofit sector only, which can be seen in the third column. Looking at public institutions, we actually find lower accessibility for children of higher socioeconomic status, at least when we use education as the indicator. Additionally, we investigated whether inequalities between neighborhoods changed over the sample period, and for this we included an interaction term between the respective measure of neighborhood quality and time. In this example, I only show you education as a measure of neighborhood quality. And the interaction term is positive, indicating that richer areas profited overly much from the general expansion of childcare facilities. So inequalities increased over time. And again, the nonprofit daycare institutions account for this result, which can be seen in the third column. So to summarize the project quickly, we find substantial and persistent differences in accessibility between more and less deprived locations, and nonprofit organizations drive this result. And we think that a policy change towards an increased role of nonprofit organizations in provision undermines the universalistic character of the childcare system in Vienna. More generally, I hope I was able to give you an idea how to use geodata in nonprofit sector research. I think this kind of analysis could also be applied to other nonprofit fields, such as care homes or advice centers. I think geodata for this should be relatively easy to obtain. Also, small-scale population data have become available not only in Austria, but in other countries. I know of Finland, Norway, and Sweden. And I think they will become more widespread in the future. So thank you for listening, and I'm happy to answer any questions.
Excellent. Thank you very much, Astrid. That was really good. So just a reminder, if people want to ask questions, then you can make comments in the YouTube chat, and I'll pass them on. But I'll also ask Astrid some questions as well. So I'll preface that by saying I really haven't used many spatial methods, so it's not an area I know a lot about. So I'm not going to ask anything too complicated. I guess first of all, I was interested. So in the sort of substantive results, you said the difference is really driven by the non-profits. I mean, just so I understand that, is that suggesting that obviously you've seen a rise in the number of non-profits, and is that suggesting the non-profits have been acting more like private firms, that they're choosing the location that they're opening new centers, and they're choosing more desirable areas, and that's what's driving it, or is that not quite right?
Yeah, nonprofits locate in richer areas, so that's the message. But it's quite fascinating to think about why this is the case, given the fact that they get the same funding no matter in which location they open their institutions. So we thought about this a bit and have come up with different explanations, that we cannot test somehow, but we can just think about what could be the matter. And first of all, it could still be a question of affordability. Although childcare is free in Vienna, free to use for all parents, nonprofits have become creative in charging extra costs that should not really be an extra cost, but they still do it sometimes. And maybe it's not only financial resources, but time resources. That's what we thought of, that the need for parents to offer volunteer time is higher in nonprofit institutions than in public institutions. And as we know that volunteer rates are differ between socioeconomic groups, that could be an explanation. And a third explanation that we thought of is that many new nonprofit daycare institutions were founded by parents who had the need of an institution. And also there could be unequal rates between socioeconomic groups, having the knowledge, having the know-how, how to do this. But we don't really know.
Sure. No. Yeah, it's difficult to untangle those effects. So obviously in that accessibility measure, you bring together a number of different measures. I guess I was interested in what might be driving the change in that measure, but I don't know from how it's calculated whether it's possible to think about that. But I got the impression from the descriptives that it's the number of organizations increasing that was the kind of perhaps the biggest factor, rather than those organizations getting bigger, or a change in the number of children, for example. Would that be fair?
I think it is a combination, but more children would be counterproductive. So
sure,
I think it really is both, and we also looked at that. We used now the growth, the number of nursery groups, but we also looked at the growth of the number of institutions. And I'm not too sure now if that would make a huge difference in results. I think both happened.
Sure. Yeah. No. That's fair. Obviously, the attraction of the accessibility measure that you're using is that it captures different dimensions that are important and on supply side. So that makes sense. I guess then. So another nice feature of the paper is that you've combined lots of different data sources. I wondered if you could say a little bit more about how easy that was to do, and the quality of that data, whether you felt you were able to get the data that you really needed, or whether there were other things that you would have ideally liked to have.
Ideally, first of all, what I would like to have is income on a smaller spatial level, because this was impossible to get for us, although we know that this information exists, but we couldn't get the data. So that would have been really nice to have it on a smaller scale. And the population data had to be bought, while we got the information for the childcare centers for free. And then it was quite time consuming for us to link all the data. We got the annual data for all childcare institutions, but they weren't actually a real panel data set. But we really had to look at this manually for all childcare institutions, whether they were the same from one year to the other, and linking this information was quite time consuming, but straightforward work. It wasn't hard work, it was only time consuming.
Sure.
So
yeah.
I would say I really do think that this could be relatively easy to apply to other fields, because all people have to know where their next nursery home is, where their next advice center is. So this is usually information that is relatively easy to obtain on the internet, and with these lists, this is more or less all you need to answer such a question. The population data is certainly harder to get.
Yeah, and I guess that's one of the aspects of data projects that's often hidden, the amount of work that goes into cleaning and preparing in order to have these nice data sets. So, that's one thing I'm keen to tease out in this seminar series. So I guess that led into my next question, which is how easy it would be for other people to do something similar elsewhere. I guess when you present the accessibility measure, when the formula and whatever, it looks quite complicated, but it's obviously possible to combine the different elements. You obviously had fairly detailed geographic information. I wonder how typical that is, or whether how easy it might be in some contexts to really accurately locate exactly where an address is, or something like that. So I'm not sure whether the geographic data, the precision of the geographic data you had access to is fairly typical, or whether you feel that was particularly good geographic data.
Well, I think the really small scale level of population data is something that has only recently come up in research. So not too, I don't know of too many papers that use such fine-grained information, and that's certainly something, at least I hope, where we are really innovative. But I'm sure that this will be more widespread soon. So yeah.
Excellent. Yeah, I mean, I guess I'm just thinking, similarly in a UK context, for example, if we had coordinates for our postal codes within an urban area, they would be quite precise, because the postcode areas would be quite small. In a more rural setting, those postal areas could be larger, and there would be less precision. So I guess there's maybe a difference there.
But maybe when I think of our question, maybe in a rural area, of course, the catchment area would be bigger, because
that's true.
It can't be 500 meter everywhere, obviously. So maybe precision is not that important in a more rural context.
Yeah, no, that's fair. But yeah, I think it's a really nice example of using some really interesting geocoded data and combining it with other data sources to tackle an interesting question. So I think that's all the question we have. So thank you very much, Astrid. That was
a pleasure.
Really good. Yeah, really enjoyed that. So thank you to everybody who's watching. But remember, this will be available as a recording at the same link on YouTube afterwards. So you can watch a recording, you can share with others, you can come back to it. And the Astrid's slides will also be available on the GitHub page, so that the link is in the video description below if you want to see that. And at that link, you can also see recordings of our previous seminars as well. So please do go and check them out if you haven't already. Our next seminar is in just under a month's time. It's on the 18th of April. Tom Wallace is going to be talking about Twitter data and how charity size might affect the use of social network data. So another example of using some data to learn something about the sector. So please do comment. I'm always interested in feedback on the seminars. We're looking for more presenters for our third season, if you like, after the summer. So if you have work on or about the third sector, the nonprofit sector, focusing on data or methods, then please do send me an email. Please get in touch. We're keen to have as many different projects as possible. But until then, we'll see you next time. Thank you.